There are so many different efforts happening both in Colorado and across the country when it comes to the opioid crisis, but unfortunately, it is still taking lives. Joining us today is Steve Carlton. He's a licensed clinical social worker and a certified addiction specialist. Thank you so much for coming in.
Great to be with you.
Yeah, you know, unfortunately, I think especially at the height of the pandemic, we started to see the overdose numbers really start to spike. What happened in 2023? What did we see?
In 2023, it's staying on par. Like
Okay.
the overdose rates they're not going up substantially. They're also not coming down substantially. I think with some of the efforts, we've managed to hopefully plateau it a little bit.
Okay. And what do you think has been the most effective or what's been reaching people?
I think the most effective thing is Narcan or Naloxone, the rescue kits that when people overdose, it saves their lives. And the other thing is harm reduction programs like Front Range Clinic, where you provide buprenorphine to people, the medication that keeps those cravings and withdrawals from coming on.
I feel like, unfortunately, every time we talk, there's something new that's being introduced into the supply, something new that people are taking. What is it right now?
It's nitazene. So there is a new, fentanyl is a synthetic opiate, so is nitazene. So nitazene is about 40 times stronger than fentanyl. So it's a stronger one. And so we're starting to see this show up in the supply some too. And we need to catch up with testing because a lot of the drug tests right now don't catch it, it doesn't turn up, and so we need to do some more homework and see how much that's happening.
And when you say it's showing up in the supply, that means you know that people are taking it right now. Okay.
And not knowing.
And not knowing. And that's a really, can you expand on that? Because that's a really critical thing that I think we talk about every time.
That's the most important thing people at home should know, is that street drugs in Colorado, you think you're buying one thing and you're getting something else in that supply, right? You think you're buying a sedative and really you're getting a fentanyl or a nitazene, and that's really scary.
Yeah. And now naloxone works with this new one?
Yeah.
Okay.
Yeah, naloxone still works with nitazene, so we should still be pushing that. We should still make sure that parents are stocking that, schools are providing that it's out there, because that is a life-saving measure. 80% of overdoses, people are using substances, and about 15–16% of the time, people overdose thinking they're taking something else when in reality they're ingesting fentanyl.
There's no check. There's no way to know what is actually being given to you. I think what's really interesting is over the last couple of years, we've seen this really big push to introduce naloxone in the community, and you actually are starting to see it in a lot of places. It is easier to get to.
Absolutely, yeah, and I think we've pushed back on a lot of that stigma with it too, and so people are now recognizing, like, this is important. This is something that can save somebody's life, and it doesn't increase people's likelihood to use. I think that's what a lot of people
that was
think.
a huge stigma with that. We're almost out of time, but if a person needs to turn somewhere for some help, where would you suggest they go?
FrontRangeClinics.com for opioid use is a great place. It's low barrier, high access to care. We work with just about everybody. It's a great place to start out.
Awesome. Well, thank you so much for coming in. We appreciate it.
My pleasure.